Hi, I'm Juliana Mulvey. I'm a student physical therapist, and we're going to find some landmarks on you today. Is that all right?
Mm-hmm.
All right, can you lay down on your belly?
Sure.
Perfect. Sorry if I touch your lower back.
Yes.
Okay. So the first thing I'm going to find is a PSIS. So I find that by finding the iliac crest and then moving in medially. And then once you land on a bony prominence, that is the PSIS. The PSIS is very important because if you fall that all the way in medially, that is the S2. And then it has a sacroiliac ligament, posterior sacroiliac ligament attached there. So if we go back to S2 and we work our way up to S1 and to L5, that is a very important spot because there's pain between L4 and L5 vertebral bodies. L5 also helps us go up further to L4, L3, and further on. And then we're going to find the inferior lateral angle of the sacrum. So is it okay if I fold down your pants just a little bit?
Mm-hmm.
Okay, perfect. So we're going to go back to the PSIS, and then we're going to go inferiorly right onto the sacrum. So from the sacrum, we're going to follow it. And it's going to go out a little laterally, and then it goes in medially. Once it starts to turn, that's when you know you're on the inferior lateral angle of the sacrum. This is an important spot because it has a sacrotuberous ligament attached there and also the long posterior sacroiliac ligament. Okay, next we're going to find the ischial tuberosity. Is it all right if I touch your lower butt / upper thigh?
That's fine.
Okay, perfect. So what we're going to do is we're going to take our palm and go right into the gluteal fold. We're going to push up, and then that bony prominence right there is the ischial tuberosity. This is very important because it has a sacrotuberous ligament attached to it and also the hamstrings attached there. So finally, we're going to find the 12th rib. So what we're going to do there is we're going to go all the way laterally and then work our way up until we find a bony prominence. That's when you know you're on the 12th rib, which is a floating rib. And you can follow that in posteriorly till you find T12. You can also, from the 12th rib, you can go up to the 11th rib and so on. Okay, now we're going to be palpating some structures in supine. So can you lay on your back, please?
Sure.
Perfect. So the first thing we're going to find is ASIS. Is it okay if I touch your lower stomach area? Okay. So we find the iliac crest and come forward, and then that first bony protuberance right there is the ASIS. This is very important because the sartorius is inserted here, and then also the inguinal ligament. The sartorius, which is the lateral border to the medial femoral triangle, goes from the ASIS to the medial superior tibia. The inguinal ligament, which also from the ASIS, goes from there to the pubic tubercle. And can you cross your legs here? Perfect. And then resist my hand. I'm going to push down, okay?
Okay.
Perfect. So right here, you can see the adductor longus and then the sartorius up there. And the medial femoral triangle is important because the femoral nerve, femoral artery go through here, and we can find the femoral pulse and make sure her lower extremities are getting enough blood supply. Okay, and now we're going to find the liver. That is in the upper right quadrant of the stomach. And so it goes underneath the ribs. And so if you go right off the ribs, right here, there's going to be a kind of firm infeel. This is important for us. So if there's any pain or anything in the liver, we can get her referral to the doctor. Make sure that gets checked out since that is out of our scope. Okay, and now we're going to move to her neck. Lift up your head. Perfect. And then you can relax. So if you feel the bottom of the occiput and then go down, there's going to be a divot and then a bony protuberance. This bony protuberance here is going to be C2. C2 is important because you can follow it down and follow the other spinous processes like C3, C4, etc. Or you can go a little laterally and feel the paraspinal muscles. Another important structure is the articular pillars, and you can find that by going deep to the paraspinal muscles. You can also go a little bit more laterally, and then you feel the facet joints. All right, can you lay on your side for me?
Sure.
Sorry, if I touch your upper hip? Okay, so we're gonna find the greater trochanter. So what I'm gonna do is just follow up with the palm of my hand. And then when I find a bony protuberance, that right there is the greater trochanter. The greater trochanter is very important because if you have any pelvic or back pain, a lot of time is referred there. Also, the intrinsic hip muscles are attached like the piriformis. All right, now that we have the patient in a sitting position, we're gonna find some other structures. Is it all right if I touch your back? Okay, the first thing we're gonna find is C6 to C7. So that is just feeling the cervical spine is the largest protuberance or largest bony prominence. And if I go right above that, that should be C6. So if I have her flex her head and extend, can you put your head forward and back? Perfect. I know that my thumb is on C6 because it disappears in extension and comes back out in flexion. These are important spots because we can go further down into the thoracical region or up and find the superior cervical spine or vertebrae. The next thing I'm gonna find is the first rib. So I find that by just going down from the neck, and the first bony prominence I find is gonna be the first rib. This is a common site of pain for patients because the anterior and middle scalenes attach here. You can also follow it and it goes underneath the clavicle and then it attaches to the manubrium right there. Okay, and next we're gonna find the AC joint. So we find that by following the clavicle, and then as it comes into the acromion, there's a space, and that is the joint. This is a very important joint because it is a common spot for separation. You can also keep going on the acromion and then further onto the acromion spine. The scapular spine. Okay, and next we're gonna do the subacromial space. So if we're going back on the acromion and just go laterally, we're gonna drop off, and that little space there is the subacromial space. This is important because the supraspinatus muscle goes through this space, and there's also bursa, so it's a common spot for bursitis. We're gonna continue down right onto the greater tuberosity. The greater tuberosity is important because a lot of the rotator cuff muscles attach here, and it also is the lateral border to the intertubercular groove, which has a long head of the biceps brachii going through that. Okay, we're gonna go on to the coracoid process. So if you go onto the clavicle, the lateral edge, and then just drop down, there's gonna be a bony prominence right there, and that is the coracoid process. This is important because there's lots of muscular attachments such as pectoralis minor and also the biceps brachii short head. Okay, we're gonna go back to the scapular spine. So as I said before, go to the acromion and then follow posteriorly onto the scapular spine. We can transversely go over this, and above is the supraspinatus muscle and below is the infraspinatus muscle. If we keep following it, it will reach the medial border of the scapula. If from the medial border of the scapula, we can keep going, following. Can you actually put your hand behind you? Perfect. And then you can follow it, and that is, if you want to move the camera a little bit, an easy way to find the inferior angle of the scapula. This is important because the teres major attaches here, and you can also follow it to the lateral side of the scapula. Now we're gonna move to the arm. So is it all right if I touch your arm here? Okay, if we follow down right here, you can feel that is the medial epicondyle. This is important because it's attachment point for the flexors. And also if you move posteriorly, you're in the ulcernine process. And if you go on the other side and also feel down right here, that is going to be the lateral epicondyle. This is important because if you go, well, it's first of all the attachment point for the extensors, and then if you go distally a little bit, sorry, I'm gonna go this way, you're on the head of the radius and the annular ligament. So the radial head is also very important structure, because if you hold on to it and have her pronate and supinate, so twist your hand, perfect. You can feel it twist in the ligament. You can also follow it distally all the way to the joint of the wrist. Okay, and now we're gonna move to the hand. So the first thing I'm gonna have you do is I want you to pull your thumb out like that. So right here is the scaphoid bone. So this is the anatomical snuff box right here, and right in between is the scaphoid bone. This is a common site of injury if you fall with your hand flexed. Also, on this bone, the abductor hallucis brevis is attached. So on the other side, on the ulnar side, very laterally, so you go to the joint line, and then that bone, right after the joint line, is the triquetral. This is a very important bone because if you go medially, you'll be right in the pisiform, so it's an easy way to find that bone. And then if you go further laterally, you will be in the tunnel of Guénon. All right, now we're gonna palpate some structures in the knee and foot. So we're gonna start at the patella and work our way down into the joint line of the knee. If we work our way medially, we will feel once we get pushed out, while we follow the joint line, that is the medial collateral ligament. And then laterally we go, if we follow it, that is the lateral collateral ligament. Also, we have her invert her foot. You can feel the medial meniscus pop out. All right, and then now we're gonna find the fibular head, which is on the lateral side of the leg. So we can do that by just feeling up, and then that bony prominence right here, that is the fibular head. This is an important spot because the lateral collateral ligament attaches here, and also the fibularis longus and brevis. And then as we move down the leg, and right on top of the foot, right here is the talus. From here, we can move medially to the deltoid ligament, and that is a broad ligament. And then we can also go laterally to the anterior talofibular ligament, which is right here. The anterior talofibular ligament goes from the fibula to the talus, and it is a very common spot for ankle sprains. It restricts too much plantar flexion and inversion. All right, and now we're gonna do some bones in the foot. If we go on the medial side here and feel this bony protuberance right here is the navicular tuberosity. This is important because a spring ligament attaches here, and also the tibialis posterior. Now, if you find the base of the fifth metatarsal, you do the same thing. You feel with the palm of your hand, and that bony protuberance right there is the base of the fifth metatarsal. This is an important site because the fibularis brevis attaches here, and then if you go proximally, just right over that, you're going to be right on the cuboid bone.